This is Nicole Locks, EHR Resource Manager here at Group 1 Health Source. I've been working with EMR systems for over 17 years and a certified ECW implementation specialist for 15 years. I've seen a lot of changes over the years with EMR and PM systems. ECW version 11E is bringing exciting things right here to our fingertips. Make sure to check out this version to see the new features that are here and in the works. Understanding the file build of ECW is vital for the correct setup of your database. The strength of a building lies in its foundation. The foundation of ECW is the setup for both your EMR and your practice management sections. In this video, we will show you the setup for practice management and give you a brief demonstration of billing in ECW. I will be given this demonstration in version 11E. This may look a little different from the version of ECW you are using, but it's a great option to access ECW from everywhere. I'm using a test database, so none of this information is real. So let's get started. First, where I want to take you to is facilities. So if we go to the menu section and we have the ability to find facilities, this is a listing of all the facilities your providers treat patients from. The listing will include your primary practice, any urgent care, surgery centers, nursing homes, and hospitals. The facility in bold is your default facility. So let's take a look at our default facility. At the top, you're going to notice the name of the facility, the type, whether it's practicing, consulting, or hospital, the code that is used for that specific facility, and also the resource color. The color is important to your front office staff members so that they can see where the provider is seeing patients at on this specific date. Underneath that, you're going to see a couple of tabs. Let's start with the street address. This tab is your physical address location information with phone numbers as well as fax. The next section we want to go to is your billing address. Now, the billing address tab is always here no matter how many facilities you enter. The information here really only needs to be put in if you tie it to a provider, which I'm going to show you in the next screen, as their billing facility address. So this is the information that when you credential with an insurance, it's their pay to information, where those checks are going to be sent to. So here, our pay to is actually a PO box. So we've gone ahead and put that information into the system along with a telephone number. This telephone number would be important because this would be your patient account phone number. This is going to show up on statements for them to actually call your patient accounts department to be able to get details on patient statements. We also down here have checks payable to. This is another location where it's going to go to your patient statements and it's going to give the ability to your patients to see where they send those checks. Now, the last tab here, facility IDs, if we take a look at that, you're going to see quite a few fields here that show you information related to billing. Let's start with CLIA. So this is where you're going to put in either your CLIA ID or your CLIA waiver number. That information, again, will populate to claims when needed for in-house labs. Underneath that is your taxonomy code. There is a directory box here for you to pull up a whole listing of taxonomy codes, but of course you can also just type that in. Facility type, again, this is a listing. Most of the time it is 77. And if I come right down here, NPI number, this is going to be your facility NPI number. We want to make sure that that is completed as well. Underneath that is place of service. You always have to tie a place of service to a facility, but of course, if it's a hospital where you could be in the ER or it's an inpatient, you'll be able to select that at the encounter level. If you need to add a new facility, of course, you have the new option right here. This will give you the ability to create a brand new facility, whether it's a hospital, surgery center, whatever it would be. The next section that I want to go to is the provider setup, and this is actually done in the admin section. So in 11E, admin is actually down here at the bottom. So if I go to admin, if you're using an EXE version, of course, admin is going to be that top gray bar. So if I go to admin, I have the ability to select providers. And here, this is a listing of all the providers in my database. So if I want to go ahead and select one of my providers, I'm going to select Sam Willis. Now, you are going to see that there's lots of fields here. I want to touch on just the fields that relate to the billing section. Okay, so first what we want to look at is the taxonomy code. Of course, this is going to be the provider's individual taxonomy code. Right over here, you're going to see provider initials. The reason that I put this on the list is because it's important when you're in claims. If you're looking at a big bunch of claims and it's for multiple providers, you're not going to see the provider's name. Instead, you're going to see their initials. The next option is if you're using the add-on service of Smart Search, we want to make sure that you enable Smart Search for that specific provider. If we go down to the next section, it's tax ID type. So tax ID type, you actually have a radio button here to select the type of tax ID number that you're using or social security number. Most of the time it's employer ID number. And then underneath that, you're actually going to put in the tax ID number in the provider tax ID field. Across from that, we have individual NPI number. So of course, this is going to be the provider's NPI number. And then the billing facility. This was that important section that I was talking about, pulling the pay to address to box 33 on your HCFA. So this here, you are selecting the facility to use the billing tab to pull that information to box 33. One other field here is your tax ID suffix / provider site ID. This is used for your clearinghouse. They normally give you a provider site ID, and you want to go ahead and make sure that you put that information here. If you have made any changes, you'll have to enter your CAPTCHA information and then go ahead and say, okay. Since I didn't make any changes, I'm just going to go ahead and hit cancel. And that's going to take me back to my listing of providers. The next section under admin is staff members. This is where all the staff members that you have at your clinic are going to be listed. The reason that it's important is to make sure that everyone has their own specific username and password, and this is where you set that information up from. So if I just go in here to billing, this would be an individual last name and first name, but you would have the ability to put in additional details. The next option that we're going to go to is under our file menu. So if we go to menu, file, and then we want to look at security settings. There's a couple of different options that you will learn about when you're setting up your system with security settings. The way that my test database is set up is by role. It makes it a little bit easy to actually manage the security attributes when it's set up by roles. So what happens here is you have different roles. Notice I have a billing admin, which would be the management level, but then I actually just have a billing as well. So here you're able to set up a role and then also set the security attributes for that specific role, and then apply all of the staff members that apply to that specific role. It makes it much easier for managing your security attributes. Each time a new version of ECW comes out, they add multiple different attributes. So instead of having to update 15 different staff members and providers with attribute codes, you actually can do it by role, which makes it take less time for you. So now let's go back to our file menu and start going through some of the options. So under our menu file, the first option we have here is insurances. This is a listing of all of the insurances used by the practice. It is important to keep this list up to date with accurate information and do not create duplicate insurances. So if I want to update an insurance, let's take Blue Cross Blue Shield. I can actually come over to the pencil to edit it. And let's take a look at the different fields here. So my first tab here, addresses, that's the information that is shown on the screen. If you're using EXE, again, this information will actually, all of these different tabs here will be at the top instead of on the left like they are here. So here it's showing me the name of the insurance, the address information, the telephone number. Also down below here, it shows our source of payment as well as insurance type that is used for billing. On the right-hand side, we have payer ID number for claims. We have the ERA payer ID number, as well as our eligibility payer ID number. You want to make sure that you have the most up-to-date listing from your clearinghouse of the payer ID numbers so that you can keep this information up to date. Next is your claim submission. How are you going to submit this claim? Is it electronic or by paper? You want to mark the radio button. Next is claim type. Are you sending a HCFA, a UB, or is this a dental claim? Down at the bottom, you do have the ability to mark it inactive. So there's really no deleting. Once you use that insurance and it's tied to patients, it's tied to claims, it's tied to payments, there's not an option to delete it. So they have added the option to mark it inactive. So if we go over to the left-hand side, we actually have some different tabs. So let's start here with provider numbers. Provider numbers has been replaced with NPI numbers on most of the time on claims, but occasionally you will still have an insurance company where they want a specific number listed in 24J or 33B. So here we call these legacy numbers. If I use my pencil to update this information, you will see here that we have 24J. We can put in the information as well as 33 pen and 33 group. So over here on the left-hand side, here is the provider. You can see that's going in 24J as well as 33 pen. And then our group number, that is actually going to 33 group. Again, that is very specific to certain insurances. A lot of times it is Medicaid insurances where they want a legacy number on the claim. So the next one is capitation. If your insurance is a capitated plan, this allows you to set up the financial adjustment code and also the dollar amount that you receive per patient from the insurance company. The next section is EDI ANSI. Here you'll see some options over on the left-hand side. For example, if it's going in 5010 format, if you are in production for this to be able to send this particular insurance electronically. And there's a couple other options. Send secondary and tertiary claims electronic. If you have the ability with your clearinghouse to send claims that are secondary or tertiary electronic, you have to start the setup by marking it here. Over on the right-hand side, you'll see NPI configuration electronic claims as well as HCFA. So this information here, if you need to send legacy numbers, which is your provider number tab here, you'll want to make sure that you come in here and you select which fields you want to send, either electronic or by HCFA when you print that claim out. If you actually look at the HCFA format, it's a little bit easier to understand because it gives you those boxes on the HCFA. So those naming conventions here, if you look at a ICHFA, it does say for 33B, it says billing provider. The same for 24J, it's actually going to say on the ICHFA rendering provider. So just a little bit of help there if you're having some difficulty with the electronic setup for NPI and legacy configuration. Now, the next two, the UB setup as well as the FQHC setup, those are both used for RHC and FQHC practices to set up their insurances so that you have the ability to split your claims and print the correct CPT codes on those individual claims. So let's go into EDI ANSI 2. Here at the top, you're going to see taxonomy code configuration rules. Again, this is very specific to insurances that are requiring you to send taxonomy codes in a different billing loop electronically. So here, if you enable this option, now you have the ability to select, here's our billing loop 2000A, and where from the system do you want to pull that different taxonomy code? Again, that is used normally for Medicaid systems that I have seen. Down below here are miscellaneous options. This is in each one of the insurances. They continue to add things to this listing, but again, this would be specific to insurance companies. So you want to make sure you understand the options here and what insurances need to have certain things checked. Back at our insurance lookup, I want to show you one feature. It's down here at the bottom and it's called Insurance Hub. So I still have my Blue Cross Blue Shield insurance selected, and if I go to Insurance Hub, it actually gives me a quick glance here of some data. So at the top, you're able to see the patients that are tied to this insurance, if they are primary, secondary, or tertiary. And then down below, it's actually giving me the number of claims that are outstanding with the financial information, and then how old those claims are. So just a quick glance of information that could be helpful to you and the billing team to be able to see what's outstanding without having to go to EBO to run a report. If you need to add a new insurance at the top, you have the ability to select new. That is going to give you a blank screen to enter all the information that we just went through. You can actually copy an insurance as well. So for example, if you had a United Healthcare and it had a different address, you'd be able to highlight United Healthcare, say new copy, then you have the ability to have all of that information there, but maybe just change the address information. So a really nice feature to use copy. If we go back to our file menu, there are a couple features here that I want to show you. We have insurance participation by provider and then insurance by provider lookup. This can be used, you can actually do the configuration part, and you have the ability to come in here and set up what providers in your office accept the insurance and if they're in network with that insurance. So this is the configuration, so you actually have to go through each provider and set those items up. And by security then, what happens is you can give your front office staff or the people taking appointments the ability to use the insurance by provider lookup. And so if we look at Sam Willis here, these are the insurance that he accepts and also if he's in network. So a really nice feature there to be able to use. We go back to the menu and we're going to go back underneath File, and we have the option for insurance groups right down here. Most of the time when you see groups inside of ECW, they are used either inside of ECW for reporting or they are used externally in EBO for reporting. So insurance groups allows you to set up different insurance groups and tie specific insurances to that group. So for example, we have a Medicare group here. You'll be able to see if I edit that I have my Medicare plans tied to, under member insurances, tied to this group. So here's my member insurances. I have my Medicare Advantage, my Medicare Part B, and also my Railroad. So depending on what you need at your practice, you have the ability to set up those groups and then link those specific insurances to them. Now, one thing you'll see here is that sometimes they're reporting, sometimes they're billing groups. Both of these work the same. It's nice when you're in the claim screen. If you want to work all of your United Healthcare claims, then what you can do is create a group for United Healthcare, tie those 10 specific United Healthcare insurances to that group. And then when you're in the claim screen, then you bring up the group instead of that individual insurance 10 different times. So great feature there. Back under our file menu, we have case managers. This is a listing of the case managers you deal with. And to give you an example here, let's just edit Sally Smith. This would be for work comp. So when you're dealing with work comp, you normally have case managers. So this gives you the ability to come in here and keep the information straight. If you needed to call Sally, you'd have her telephone number or her email address right here. If you needed to add a new one, again, new option right up here in the upper right-hand corner. The next option is Guarantors. This allows you to search, add, and update the guarantors in the database. This would be important if you're wanting to send patient statements to someone else besides the patient. An example of where you would use this for is a pediatric office. Instead of sending the patient the statement, you would actually be able to send that to mom or dad. So if I search here, you'll be able to see these are the different guarantors that we have set up in this database. So if we update one of the options here, you will see that the guarantors have the ability, they've got 4 different tabs, and you can come in here and enter that information. The more information that you collect, the easier it's going to be at the end of the billing cycle to collect on those patient balances. So you want to make sure that you're going through each one of these tabs when you set up a guarantor. So you can see we've got the telephone number, we've got address information, employment information, and of course the other option is just where you can put a note in. You can tie guarantors to patients and you can tie them to multiple patients. So if mom has 3 children, she would be the guarantor and each of those children would be linked to that same guarantor. The next section we want to go to is provider numbers. So still under our file menu, this information is going to show us some information that we actually entered into the admin and providers. So if we take Sam Willis here and we go to billing info, we're going to see the individual NPI as well as that taxonomy code down here. But this is the first place that we've been able to enter a group NPI. So we want to make sure that we go ahead and get that information entered. Another nice feature from this screen is you have the ability to go to referring providers. So if I change practicing providers to referring providers, here I have the ability to see the referring providers that are set up in my database. If I use the pencil, I can actually edit that information and come in here and see the details. So just a quick way to get back to referring physicians. This is really good. Sometimes staff members don't have access to admin and referring providers, so this is another way that they can get to them. So the next place that we're going to go to is the first section that you're going to be able to set up an override. So if we go to data by facility, You have provider numbers by facility that you can override, but I want to show you this group NPI rules as well. So if we set up a rule here, you can do this by provider, facility, and insurance, and also set your service date. So a really nice option here if you have a specific insurance that when you set up that group NPI for the provider, maybe it was credentialed differently. And so what we do is we give the rule a name, we set up the group NPI number or the NPI number that we want to go in its place. And then you can come down here and say what providers, what facilities, and then also what insurances. Once you're done with that, you just say save. That will be reflected on both paper claims as well as electronic claims. The next section I want to show you is mandatory fields. Here you have the ability to set up what is required when doing a referral or a referring provider. This is a great feature if there are specific items needed when creating referrals or referring providers. So if we look at the mandatory provider fields, here are the options that you have that you can set as mandatory. So you can see here, make NPI mandatory, that is checked. So when someone goes in to add a referring provider, the NPI field will have a red asterisk on it for them to make sure that they fill that in. They will not be able to go forward with any required field until it's completed. So if we go back to File, we want to go to facility groups. So we've already been through facilities. Facility groups, again, is just a reporting area. So we have the ability to add a facility group, give it a name, and then associate the facilities with that particular group. So for example, if you would have 5 separate clinics and you want to make a group so that all of them are linked together, you'd be able to name this group clinics and then select your 5 facilities under associated. So for reporting purposes, it would be nice to have that group set up like that. The next section that we're going to go to is zip codes. So right over here under File, we have zip codes. If you've ever entered a patient into the database, you would notice that it takes you to zip code before it takes you to the city. So here, what you have the ability to do is to add a zip code and create the city name. So if I just put in Jefferson City, that is going to be Missouri. And then the zip code. So now when that zip code is entered into the system, what happens is it populates both the city as well as the state so that your front office staff member or your staff member entering that information does not have to put in the city and the state. So a great feature there. So just a couple more items under the File menu. So let's go back to File, and where I want to go to is Settings. And underneath Settings, there's a bunch of different options here, but I want to take you to My Settings. Now, My Settings is specific to the user that I'm logged in as. So each staff member, each provider would have My Settings. It's important for them to go through each of the different sections so everything is set up correctly. But one thing that I want to show you here, under User Settings, you have My Home Screen. So when you log in, you have the ability to select any of these different options here. So that is the first screen that you see. So for example, a provider, they may want to select office visits. That's going to take them to the screen from where they are working from. A front office person, they may want resource schedule because that is where they're doing their task from. A billing person has the ability to select claims or payments. So some nice options there. So each one of these have different options. There's a lot of information here. Show hide is a good one because you're actually being able to say, yes, I want to see this, or no, hide it, I don't want to see it. So a lot of details here on what your system is going to look like. Okay, so just a couple more things here. So merge patients under our file menu, merge patients. This is a feature that allows you to merge two patients together. So for example, if you created duplicate patients, you've seen the patient, you got claims, you got payments, you got telephone encounters, you would be able to take those patients and merge them together. This is a feature you want to make sure you understand how it works before you try it on real patients. Once this is done, and you can see it down here in red, no one can undo it, including ECW support. So what I normally do is take two test patients and merge them together. The bottom one is normally the one that you are able to see the patient name and their demographics and insurance. So, but everything else merges together, whether that's encounters, that's claims, that's payments, everything is going to be there. So just make sure you do a little test before you use it for the first time. The last option here is change password. That is where you as the user can go in and say, here's my old password. I want to change my password to this. Go ahead and confirm it, enter your CAPTCHA, and then say submit. Now you've changed your password. The last thing is collections setup and Transworld Wizard. So if you are using Transworld for collections, this wizard will walk you through getting all the information in the system that you need to be able to submit that information directly from ECW to Transworld. So it's a great little wizard. If you are using them, make sure that you go through that to get everything set up correctly. In the next part of the video, we are going to show you some billing setup items under our billing menu. So if we go to menu, billing, we're going to go to the first option here of fee schedules. Each year, the new local Medicare fee schedule is uploaded into ECW. You will have the ability to have as many fee schedules as you decide. The more fee schedules you have, the more time it takes to keep all of them up to date. You can have a master fee schedule. This fee schedule would not have allowed amounts on it. If you decide to have a specific insurance fee schedule, you can copy the master fee schedule, then update the allowed amounts for the specific insurance company. The advantage of doing this allows you to have one set amount, which is your master fee schedule amount, as your charged amount, but each individual insurance would have the allowed amount when posting payments. This is great in theory, but you also have to get the allowed amounts from each insurance and update them each year. So if we take a look here at our fee schedules, we have the ability to create a new fee schedule, and we can call this our master fee schedule. We're going to make this our default, give it a description. Again, give it a period. I'm just going to name this 2019 and give it a date range. So it's going to start from today. It's going to end on December 31st. Here you want to go ahead and select your Medicare fee schedule to copy it from and say OK. Once that is done, we have the ability to go back in and update the fee schedule. And when we do that, we can come right here to update amount. And we said it was going to be 250% of Medicare. We're going to round to the nearest dollar. Oh, Actually, we're going to set our allowed amount to 0. This will set our allowed amount, even though we're copying it from Medicare, which does have allowed amounts in it. It will copy the allowed amount as 0, and then we're going to say OK. Once we do that, we can actually view the fee schedule. And then you would be able to see the fees here, and it would have multiplied it by 250% of the Medicare fee amount. Let's go to the next item of CPT codes. So back to our billing menu, CPT codes, and then once again, CPT and HCPCS codes. This actually gives us the listing of all of the CPT codes that are normally found in a CPT manual. So each year, these get updated by ECW so that they will have any old codes marked as deactivated, and then add any new CPT codes. One thing to note here that is important is if your providers are used to searching for a CPT code by a specific description, you want to come in here and update. If I go to the pencil, you have the ability to update the description right here in the name. So that is what they would be searching for if they needed to search by a description of a CPT code. Now, when you're in a CPT code, you do have the ability to update the type of service and the place of service. So if I just go back into a CPT code, you have requires CLIA ID. That's what makes the CLIA number from your facility go onto your claim. This is a longer description, and then also any associated codes. So here, the place of service is actually set to use as the claim or the appointment place of service, but that can be different according to the setup that you have, where you would have to select the place of service, but you also have the ability here to select the type of service for that specific CPT code. So the next items that I want to go into is explosion codes. So again, back to our billing menu, underneath our CPT codes, we actually have explosion codes. So here, let me just update this one for EKG. What this does is you have the ability to set up a series of CPT codes. The setup walks you through how to select the first CPT code, link additional codes, and associate it to work with insurance companies. This is a great option for a provider to quickly add multiple codes by only selecting one code. The example here is used for a cardiologist. When the provider would actually select this EKG code, it is going to go ahead and populate these additional 2 codes. Now, if you want to exclude the original code, that's what this option is here, to exclude the original code. So then it would only add these 2 codes to his progress note or to the claim, whichever way you guys are doing it. So up here at the top, you can apply to all payers, all the payers except the following, or apply to the following payers. So it just depends on how you need to set this up for your insurance companies. So that is the first tab, insurances. The next one is by facility. The next one is by providers. So you'd want to make sure that you go through all of those tabs to make sure that you set up each one of those different options. Now, there is also the opposite of explosion codes. So explosion codes is you're gonna pick one, it's gonna add multiple. There is also bundling, which is instead of exploding, it implodes, so it removes codes. So if we update our test option here, what would happen with this is you're able to give it a name, a specific date range if you need to, and then you can again apply it to insurances, all except the following, or apply to the following insurances. And then once you come over here and you select the CPT code, Then you can add additional codes here. So what would happen is when all these codes are used, it's actually going to only use the primary code to be on the claim. So that is the opposite of explosion codes. So back to our billing menu. And now we want to go to ICD codes. So here, just like CPT codes, ICD codes is the listing of all of the ICD codes in your system. You will notice the first column is showing you whether it's an ICD-10 or an ICD-9 code. So that is the first thing that you want to realize. The other thing that you want to do here is to be able to come in and change the descriptions, because we want to make it easy for the providers to actually find those ICD codes. One thing to note, if you are using Smart Search, you do not have to change any descriptions. From there, the provider would be easily to find the codes that he's looking for from the Smart Search section. So it's a little bit different if you're using Smart Search. The other option here is ICD groups. So you have the ability to put a bunch of ICD codes into one group if needed. That is used both for reporting as well as when you go to organize codes. So that is the next section, which is organize. This section, organize ICD and CPT. What this is used for is when the provider is in the progress note, he has the ability to see all of his codes grouped together, whether it's ICD or CPT, he can see all of those in one place. So it's kind of like having that paper super bill and taking that information and organizing it electronically. That's all you're doing here. It makes it nice and tidy for the provider. He's able to see things just like he did when he used that piece of paper for that super bill. So still under the billing menu, the next option that we have is ICHFA Mapping. So if we go right here to ICHFA Mapping, you'll notice that there is a bunch of options here. Just a couple of things to point out here. One of them is you can do the place of service and the type of service. What this does is this actually uses a payer ID number, and it says, if the place of service is this, I want you to change it to this, and you can do that by payer ID and insurance company. So a great option there if you have some specific needs for a insurance company to both set the place of service or that type of service. We see the type of service change a lot for Medicaid services. The next option under our billing menu is the default provider resource mapping. This is a great section to use if you have a nurse practitioner who does not bill out to an insurance under their own name, but bills out under a supervising or billing provider. To use this, remember the same supervising provider should be used every day. If a supervising provider is not the same every day, there's a different setup that you would use under the miscellaneous configuration options under provider submission rules. So the next option that we have is the default provider mapping. So if we select that, and it's actually default provider / resource mapping, what this allows you to do is if you have a nurse practitioner, for example, who does not bill their name to the insurance company, you can actually set up some defaults here so that the billing and supervising provider will automatically change on your claim. So to do this, if we go to add the appointment provider, so we would select who that appointment provider is, and then here is the pay to rendering and supervising. So here we would want the pay to be Sam Willis, our MD. The rendering is actually going to be Mary Jones because she's the one that actually did the service, and then our supervising would be Sam Willis. And you can either do this for all appointment facilities or you can select a facility. Now, the other section up here at the top is who to apply this to. So do you want to apply it to insurances? Do you want to do a group of insurances? And once you have that done, you can say, okay, and that saves that override. So when the encounter is created into a claim, then it will change those specific fields on the claim. If Mary Jones would not have the same supervising and billing provider, there was a different setup instead of doing it this way that you would actually use. So you would go to your miscellaneous config options under your billing menu and then go to provider submission rules. So that is a different way for you to set that up. The next option is claim edits. So if we go back to our billing menu, we go to the option of claim edits. You're going to see that there is a bunch of different options here. Just want to highlight a couple of those. Billing edits, these are very specific options that you can enable or disable according to the check mark. So you want to make sure that you go through that list and make sure things are set up correctly. Example, this one here, that is going to suppress the claim error that warns if the billed fee is $0. That is one that we don't necessarily enable because we want to see that error in case a new CPT code has been added to the system. That way we get that error and we know that we need to update that CPT code. So just an example there for you. There are some other options as well. Invalid ICD/gender. This enables you to set up an ICD code and say if it's specifically used for male or female. There is also invalid CPT payers. Another one is ANSI 5010 claim format edits. These will come in your system automatically and all be checked. When 5010 started, this is how that we got around the new rules that were there for billing. So this information should come and everything should be selected there for you. Now, one other option, if you are using your add-on service of Code Correct, this is where you actually do the Code Correct setup and configure what you want to come across for your error messages. So Code Correct does not give the provider any additional information. It's actually used by the billing staff in the claim screen. So it's a great addition for your billers to be able to have those additional errors. Now, if we go back to our billing menu, the next option is lock/hard close. This is where you have the ability to set up under the options and then actually run your hard close transactions from the transaction site here. But what the lock hard close does is if you want to be able to secure that data where it cannot be changed each month, this is where you would go to set that up. This is a great thing. Your accountants will love this piece because anything that's done in January is locked down and no additional charges or payments can be added to the month of January once that month is hard closed. So it's a really nice option. You do have to understand the functionality here because once you do it, it cannot be undone even by support. So you want to make sure that you actually get that set up correctly, as well as understand the options of what you are setting up. The next option here is Reconcile. You are going to use this section periodically to run items if they are out of balance. For example, patient statements. There are different options in here, but this is something periodically you need to come in and take a look at and make sure that everything is correct in the system. Clearinghouse. You will see here this clearinghouse listing. There are different clearinghouses. These are all the integrated clearinghouses. It's really nice to use an integrated clearinghouse because it gives your staff members some additional options when they are submitting things. So for example, when you create your batch of claims to send to your clearinghouse, if you are using an integrated clearinghouse, that can be done straight from the system. If you're not using an integrated clearinghouse, what happens is they have to save the batch. Then they have to go out of ECW to a website and upload that batch. So it does save some time. It is a really nice feature to use one of the integrated clearinghouses. The next option is capitation. So we talked a little bit about this during the insurance setup. So if we go here to capitation, this is where you can set it up and then also see the plans that you have selected to be capitated at the insurance level. So the setup, what that does is gives you the ability to create that financial adjustment code for your capitated. And then the plans, once you select that it's a capitated insurance plan, then it's going to show up here for you. You can actually view your outstanding claims by insurance and have the ability to go ahead and take that capitation based on the CPT codes that you have set up. Back to our billing menu. The next item that we have is our setup collections. So this collections here, there is a collection management section in our billing area. And what that allows us to do is when we send so many statements, we can now send a letter to the patient. So this gives you the ability to, how many days in between do you want to send these letters? And then you can set up your cycles, and also you can create documents so that when you put a patient in that cycle, you can go ahead and generate a letter. So really nice feature here. If they have a minimum payment required or there is a threshold percentage, you can go ahead and set that up so that if they make a patient payment, then it will not throw them into the next cycle. And then external collection, additional setup, that again is for TransWorld. The next one is set up patient statements. So here, set up patient statements. There is, again, a couple of different tabs here that we want to go through, but right here at the top, you're really setting up your rules. So how many days in between are you going to send your patient statements? Are you going to do it once a month? Are you going to do it weekly? How are you going to do that? So this one is set up for 30 days, meaning every 30 days I'm going to run statements. That I want a patient to get a statement. The next option there is what's the account balance? So normally we do it on the 99, so that if it's $4.99, that means anybody that has a balance of $5 or higher, we would send a patient statement to. This one's set up for $9.99. So that means that anybody that has a balance of $10 or more is going to get a patient statement. The next option are your dunning messages. So according to the age of the patient balance, this is going to be per claim on the statement what message they are receiving. So really nice options there to add those dunning messages. Down here below is move to collections. So this is the number of days and also the number of patient statements that have been sent to when you can send them to the collection management area of ECW. So notice this means we're going to send them 3 statements or it's going to be 90 days. Then we have the ability to move them into the collection management. Okay, you also do have the ability, this is a newer feature with version 11, to be able to set up a custom message. Really nice option there for you to be able to edit that information. Statement details printing option. So this is what details are going to show up on your statement. Remember, it is going to be claim based. So each claim that is out to patient responsibility is going to show up on that patient statement. And then within that particular claim, what information do you want to show on the statement? So you've got some options there. Under the billing address, this is going to be the billing address that shows up on the statement. So do you want to use your primary default facility or do you want to use a different facility? Just have to make that decision. Now, another option here was our setup payment type. So when creating payments, ECW comes with many different payment types already set up for you by default. If you decide you need additional options or you want to use the copay variance report, additional payment types will need to be set up. So very easy to do. You come up here to the add, and then you can use a code, put in the name of it, and then also tie it to whether it is insurance, patient, or both, what type. So great option there to be able to add some additional information if you need to track and run reports by different payment types. So the next section we're going to go to is codes. You will notice there's lots of ability to add different types of codes. Of course, your adjustment codes, easy enough. Those are your financial adjustments. You have the ability to come in and set your own adjustment codes up. You can run EBO reports by these financial adjustment codes. Notice it does say financial adjustments. You can also put a color so that if you take an adjustment when you're looking at the account inquiry for a patient, it will actually be highlighted with the color that you specify here. So collections is a nice one to do that for if you are writing things off before you send that over to the collection agency. You can make that a different color and it really stands out for your staff members to be able to see that. Of course, you've got the add or update to be able to go in and either add a new one or update something that is already existing. So additional codes. If we go back, we also have adjustment groups. So again, for reporting purposes, do you want to take your codes and add them to one specific group? Billing message codes. These billing message codes, you have the ability either at the claim level or at the payment level to be able to say, patient, this is the information of why we took the adjustment, or this is the information of why we are sending this to your responsibility to go ahead and pay. So for example, deductible. So you would be able to come in here and add your own billing message codes. You can make this more detailed. Hopefully what this does is give the patient enough information of why they are getting a patient statement for that particular claim so that they don't have to call and ask questions. Really nice feature there. We also have claim status codes and claim status groups. So of course the codes here, what this is for is this is a longer list that comes directly with your system. You do have the ability to add new items. One thing in version 11 is they are taking away the ability to delete anything that was system generated. So these items here, I would not be able to delete those. But this is actually where your claims live inside the claims module. So when you're looking at claims, you're going to have claims that are in pending. You're going to have claims that are ready to submit electronic, ready to print a HCFA, and so on, even patient responsibility. So if there are different options that you need, you'll be able to select new and go ahead and set up that claim status, even give it a shortcut key, and make sure that you get those done. Great option there. So there's other different options as well on here. Make sure you go through each one of these and get those set up in your system. The next option is anesthesia. Anesthesia does have the ability to be billed out of ECW. Something that's a little bit different with anesthesia is you actually do it in minutes. And so you are able to go ahead and do the configuration as well as the mapping. So you're able to say with this CPT code, here's the minutes and here's the value for that on how to bill that out. So great feature there for surgery centers when they're actually having anesthesiologist on staff. Miscellaneous configuration options. This is a very large section. You can see here there's many different options here. So you want to make sure that you go through these to see if they apply to your practice or not. One option that I do want to hit on is the miscellaneous options right here. There's actually a couple of different tabs inside of here. This first one is just applying some different filters so that you would be able to see things. For example, If you do not want to copy the copay/demographics responsibility into the claim, so if they owe a copay, if you don't want to copy that into the claim, you can go ahead and check this and it won't send that over to patient responsibility. So you do want to take a look at these and make sure you understand them, and if they apply to your clinic, go ahead and get those features turned on. Billing option 2, important setup here on the fee schedule. This is how your fee schedule is going to pull. So you have the ability to pull it from the facility, the insurance company, or patient demographics. The least amount of setup is the facility, because normally there's less facilities than there are patients or insurance companies. Really nice feature to be able to do that. When that option is turned on, you will see a new field inside the first tab of your facility to go ahead and link the facility fee schedule that you want set up there. So great option. Down below your billing implementation, you've got your start date. You do want to make sure that you put that start date in of when you started using the billing portion of ECW. Now, optional features. This turns on some features. This is always being added to. So anytime an update happens, you want to make sure, normally at the bottom of the list is anything new that has been added. You'll see here there are some TriZetto Gateway EDI only options here that have been added. That is newer to version 11. So some great alerts that actually happen from the clearinghouse if you are using TriZetto. But pop-up messages, this was something that came out in version 10. So you now have the ability to turn on billing alerts from the patient hub when you access account inquiry